Good morning, ladies and gentlemen. Again, welcome to session 2. I hope you've all grabbed a brew and ready to rock and roll. So I think now we turn to David Wood, who joins us actually from the States, so San Diego. So that absolutely is flexible working. David is the VCHA regional lead for the north of England, with 34 years of army service and a significant work in local government. David brings a deep expertise in the Armed Forces Covenant delivery and continuous quality improvement. David, over to you. Hopefully you can hear me.
Guy, yes, thank you. Good morning, indeed, from San Diego. Ladies and gentlemen, it's really good to be able to present on this piece of work, and it's been great listening to the presentations this morning, and I think the flow is going to continue. This presentation is on continued quality improvement, and this is really about looking how the program now starts to drive forward following our full accreditation. First slide, please. And next slide. We've heard that Veteran Aware is an NHS national clinically led health quality improvement program. It's premised on an 8-point framework that offers a holistic approach to delivering Veteran Aware in NHS trusts and other health settings. Since the publication of the VCHA report in 2014 and the creation of the Veterans Covenant Healthcare Alliance, the programme has steadily evolved through a series of phases which typically advance through increasing levels of maturity as that cycle progresses. Through learning, experience and other factors that are built into the cycle or that develop as it evolves, this enhances the ability to better inform the process and the impact that it has. As the experience level grows, it can be applied to support further informed enhancements of the programme. Understanding the intended effect also enables improvements of the individual elements of the framework and their collective interaction. The 8 Veteran Aware standards effectively comprise of 6 enablers: governance, training, links, referrals, communication and employment, that inform and ensure an improved patient experience is the outcome, along with meeting the NHS commitment to the Armed Forces Covenant. Next slide, please. In this presentation, we will explore the maturing of Veteran Aware and how this has helped to form a continued quality improvement process to support health organisations following achievement of all NHS trusts accredited as Veteran Aware and other healthcare providers now included. Scope will cover some background, a look at the context of how it's applied, the evolution and maturing of the programme, the production of the CQI process itself, and a little bit on the impact. Next slide, please. We start by going back to the early days of inception when the steering group were delivering the first accreditations and the beginnings of the framework from 2018 were applied at a basic level. The first significant step in the programme is the addition of the regional lead team in 2021 that led to the production of the initial question set and direct support to organisations that sees the level developing. This development period is for both the organisation's understanding and implementing Veteran Aware and the evolution of the regional lead teams in how we deliver support. And from 2022, better informed application of the question set sees improved accreditation quality and also the commencement of reviews and reaccreditations. The inclusion of the rehab and data projects provided further opportunities to expand and share engagement learning across all trusts and wider into health, incorporating the independents, hospices and care homes that are now included in Veteran Aware and the veteran friendly framework. The main effort throughout had been to accredit all NHS trusts, and with improved engagement practices and a resource repository populated with products created by trusts such as network terms of reference, policies, templates for patient engagement practices, data capture, accreditation quality continued to grow. The concept of shifting from an accreditation awarding body to an assurance-focused approach is applied as pace to full accreditation quickened, and the main effort began to switch to enduring support as the baseline was accomplished. The context of these factors and a range of considerations must be noted, and how this next evolution sets excellent conditions for the new National Healthcare Training and Education offer. Next slide, please. All progress since 2018 has been achieved against a backdrop of a busy NHS, compounded by a pandemic and unprecedented challenges that altered traditional pressure points in the calendar that impacted on the capacity of organisations and staff to engage, to become veteran aware. The individual nature, size and type of each organisation, a starting point that spans 7 years, appointing appropriate leads, establishing teams, funded versus unfunded roles, protected time or fitting veteran aware around core roles, myriad patient systems or introducing new EPRs, and attempting to standardise an armed forces data field into such a complex scenario. How to ask the question and adapt the framework around organisational operating procedures are all considerations that have informed our understanding of how best to support, to utilise internal expertise to help better understand the armed forces community. This has helped us to build on the baseline through the future phases of implement, embed and demonstrate, with embedding being the main driver for veteran aware to endure. Next slide, please. Here we see that journey from those early accreditations, the evolution from introducing regional leads and improvements to the maturing of veteran aware and the developing quality of individual programs. The shift continues quality improvement alongside the new National Armed Forces Healthcare Training and Education Programme, updates the conditions that will enable regional leads to improve the support of embedding veteran aware. Next slide, please. The start point for producing the CQI process was to conduct an analysis of each trust progress through accreditation, review and re-accreditation, noting that some will have been subject to early accreditation against a less developed framework and review processes, whereas those accrediting more recently will have had the developed question set applied, but not have completed review or re-accreditation yet. What we have developed is a CQI matrix that takes the baseline of accreditation whenever it was achieved and interrogates the detail within each standard to help healthcare providers cultivate not just the activity that develops progress in each standard, but also supports their collective application. It is acknowledged that the desired improvements will take time to achieve given the factors and considerations presented. The matrix provides a means to conduct more detailed gap analysis that informs intent and action plans. And in initial practice, it is supporting early preparation and planning for future reviews and reaccreditations, which help support the capacity challenge. Next slide, please. To illustrate how this works, here is the CQI model applied to Standard 3. Identify members of the armed forces community and how it progresses through the implement, embed and demonstrate phases, which are grouped into time bands that reflect different points where any individual organisation might be in their journey. Some are already at or close to the embedding phase, whereas others, for reasons pertinent to individual organisation context, will take more time. The net result is that all will have the same approach applied that will over time reduce the unwarranted variation in programmes and regulate the quality level. The phase takes the baseline of having an armed forces field within its PAS or EPR as the premise to accredit. Next slide, please. To implement, we need to determine how effective data collection is through the conduct of an evaluation of application and staff engagement with patients and recording armed force status across all clinical services and relevant entry points, ensuring an understanding by staff of what asking the question means. Next slide, please. Consistent data collection across all clinical areas enables analysis of impact, which in turn provides learning opportunities from evidence-based outcomes and measures and improvements in reporting. Next slide, please. The evaluation of the identified standard has the potential to not only improve data collection and reporting, but also to inform how CQI benefits the other standards. Next slide, please. Improved data reporting integrates veteran-aware governance into organisational governance. It informs training requirements where less developed clinical areas or services are identified and can be targeted. It helps develop clarity in messaging for internal communications and promoting organisational commitment to communities. Enhancing partnership working, it strengthens relationships with local and regional support services, local military units, neighbouring health providers, all which reinforces the collaborative system effect expected of integrated care boards, which will improve referral pathways. And for the workforce, it is able to exploit the experience and expertise of existing staff in understanding the military community, the importance of asking the question and recording, which exposes the forces-friendly nature of the NHS as an employer and a care provider. Next slide, please. In summary then, The impact of continued quality improvement is already evident, albeit in pockets of best practice within some trusts and other health providers. But it is this that provides the opening to accelerate the effect and maturity of Veteran Aware through this next cycle of the programme's evolution. Good data is already demonstrating that where armed forces patients are effectively and consistently identified and supported within a system, the benefits expected in the earlier phases of the organisation and the patient have materialised. Most notable are financial and bed hour savings. Continued quality improvement applied alongside the new training and education programme will support individual veteran aware programmes as well as group and ICB efforts in providing healthcare to the armed forces community. Continued quality improvement presents an opportunity through Veteran Aware for quantitative and qualitative data on the military community to be collected and analysed on a national level that has never existed previously, and bring further improvements to the healthcare provision for the armed forces community and continuing to raise the bar higher. Thank you.
Great, thanks very much, David. That is a critical piece of work, actually, in terms of embedding what we are absolutely doing now. So moving the dial forward. And of course, a big shout out to the trusts who are under considerable pressures, but are absolutely engaging in this process. So thanks very much, David. It links absolutely into the NHS 10-year plan as well, which is important. Have a good sort of leave, David, and thank you very much for joining us from the States, and see you at the end of September. I think you're due back.
Thank you.
Great. Thanks, David.